Anyone that hits the subscribe button right now will receive a free virtual hug. Hey, what's up, y'all? And welcome into What Ails Ya. I am your host, Alan DPT. I am a physical therapist and I practice in the mobile outpatient setting. I specialize in geriatric care and skilled clinical care management. I'm hoping to use this video to share skilled clinical insights and education about healthcare and home-based physical therapy for our seasoned citizens, with the goal of advocating independence and aging in place. I really want to help you help yourself or your folks with their aging care needs. And hopefully shed a little light onto some of these differences between mobile outpatient therapy services and traditional home health therapy services. Home health, as it is commonly known, right? It's often referred for folks that are dealing with acute episodes of medical issues. These folks are typically coming out of the hospital or they're coming out of temporary placement at a skilled rehab facility. They're returning home and they typically need a little bit higher level of care and support to ensure that they're not going to return to the hospital and be able to thrive in their environment. After their home health episode of care ends, the client will either continue their course of rehabilitation with outpatient services or they'll just fly on their own. Oftentimes, I'll hear from my clients that when they discharge from a traditional home health episode of care, they're under the impression that they've come to the end of their therapy. They've graduated. They're no longer needing therapy. They're no longer eligible for therapy. And when they learn that they can still continue receiving therapy services, skilled therapy services in their home, they are often very eager to get those services on board. Mobile outpatient therapy is referred for folks that are in need of those skilled interventions. But those big barriers that we face with your traditional home health services, we don't face those with mobile outpatient. Some of these barriers include transportation, time commitment, lack of support, lack of that caregiver support to safely go out and return home. This is where mobile outpatient therapy steps in and can really provide a valuable resource, especially for our senior citizens. Mobile outpatient will come to their home, still provide that skilled care, that skilled level of therapy, with the ultimate goal of keeping them out of the hospital and maximizing their independence to promote aging in place in the comfort of their home. Nobody wants to be pulled out of their home and admitted to a skilled nursing facility. Oftentimes, I'll hear my patients verbalize that they're fearful of being taken out of their home and placed in a skilled facility where they don't want to be. So let's talk about, why do we have some of these differences if both types of therapy are happening at home instead of a clinic somewhere, right? It basically comes down to your insurance and your billing. Okay, insurance type really plays a factor in your home health therapy services when it comes to that access and affordability. Not all home health agencies are the same. Okay, not all home health agencies accept the same insurances. Not all home health agencies accept the same types of clients. Right? It's important to educate yourself about the services available in your insurance network and which service providers are covered. All right. Not all insurances are created equal. So your age and your stage should be considered when choosing between, possibly that traditional Medicare plan or that private insurance plan or that Medicare Advantage plan. Some plans are less advantageous than others depending on your medical status and care needs. Okay, so jumping back over to that traditional home health. Traditional home health is typically billed under what is known as Medicare Part A. So when we talk about Medicare Part A, I want you to think, okay, Medicare Part A, that's my hospital insurance. Okay, your Part A is going to cover your inpatient hospital stays, skilled nursing facility care, hospice care, some home health care. It really is based on a more acute care approach to patient management and interventions that are required. Skilled nursing is typically involved along with skilled therapy. And with that traditional home health, those therapists are usually triaging clients to higher levels of care versus progress to return to their previous level of function, just kind of depending on what's going on with each case. Now that traditional home health side, the Medicare A, it is regulated by your Center for Medicaid Services guidelines. Now, I'm not going to bore you and go into all the details of those guidelines. You're certainly welcome to look those up yourself. Basically, for the sake of brevity, the patient must be confined to their home. They must be in need of skilled nursing care on an intermittent basis, or physical therapy or speech language pathology, or they must have a continuing need for occupational therapy. With the Medicare A home health, those visits are reimbursed on a per visit basis. I want you to remember that. That's very important, okay? Those visits are reimbursed on a per visit basis. So the therapists are coming in and being paid, being reimbursed on the visit, all right? Now, your home health agencies, they will typically design some sort of a payment system, whether that's a point system or some other form of reimbursement to fairly compensate their therapists for coming out and providing that skilled care that you need. So when it comes to the different types of visits you may see in home health, they will be compensated in a different amount, usually, right? So your routine visit is going to pay a different rate than your start of care visit or your recertification visit, right? So they're reimbursed on a per visit rate, traditional home health. With your mobile outpatient, let me back up for just a second. A lot of times when I've worked with my traditional home health clients, I'll often hear that, or those clients that are coming off of home health over to the mobile outpatient side, I'll often hear, the therapist came out and they were here for about 30 minutes, maybe 40 minutes. They were on the computer a lot. They were doing a lot of typing. I didn't really feel like they were engaged with me. And then they would leave. They came out for just a few weeks. And then they said I was discharged, so I didn't think that I needed therapy anymore. Those are some very common things I hear from my clients. And that kind of goes back to, especially on that, they were here for 30 or 40 minutes for our regular visit. That kind of goes back to that reimbursement on a per visit payment scale. So we're going to bounce over to mobile outpatient now. Your mobile outpatient is billed under your Medicare Part B, as in boy. And when you hear that, I want you to think, okay, that's my medical insurance. Outpatient services is not the hospital insurance, right? Medicare A, hospital, Medicare B, medical. So your Medicare B is going to cover certain doctor services, outpatient care, medical supplies, preventative services. Now, the key to this is with that Medicare B side, there is no prior hospital stay requirement for Part B coverage of home health care. So with your mobile outpatient, you're getting that billing done under those Part B services where you don't have to be homebound. There doesn't have to be that skilled nursing need, right? And some of those other CMS guidelines that, my own words, I would say kind of restrict what the PT is able to do with a client and from the standpoint of visit time and things like that. Medicare B does not face that same problem, right? With that Medicare, with the mobile outpatient side, we have the ability to kind of formulate different plans of care, whether that is for an equipment plan of care, maintenance plan of care, full out rehab, making functional progress, really making some gains, taking you from a level of function that is lower than what you're used to being at and getting you back to where you want to be so that you can stay in your home and age in place. With those different plans of care, it really opens up the services that a therapist can provide in the mobile outpatient setting. And these visits are reimbursed on what is called the 8-minute rule. So with that mobile outpatient Medicare B billing, your visits are broken down into kind of 8-minute segments. So with the mobile outpatient clients I have, I like to spend anywhere between 45 to 75 minutes, depending on where they're at, their age, their stage, what's going on medically, you know, all the different things that kind of come into managing an episode of care. But since these visits are reimbursed on that 8-minute rule versus the per visit rate, now it's kind of more favorable for your therapist to spend more than 30 or 40 minutes with you. And given that we're in that mobile outpatient setting, the level of function of the client tends to be a little bit higher than what you would typically see in your traditional home health. But trust me, I have my fair share of clients I go out and see, and they probably should have those acute home health services, and we work through that and get them what they need. But when it comes to this senior care in the mobile outpatient setting, there's a very fine line sometimes between that home traditional home health acute level of care versus where they're at with that mobile outpatient referral. So I just want to throw a few interesting facts about mobile outpatient therapy services at you. Your health insurance typically covers occupational, physical, speech therapy, and social work services. Therapists tend to be able to maintain long-term relationships with their patients, allowing them to, come in as support if and when a patient's medical needs change. The therapist can really provide that longer duration longer duration visit as well as that longer duration episode of care. When I say episode of care, I'm referring to this length of time that the therapist is kind of setting aside to say, okay, we're going to be seeing each other for this long. Now, on that Medicare A traditional home health side, you typically see your episodes of care anywhere between 30, 60, 90 days. 60 tends to be kind of the average. Um, you see less 90-day episodes of care than you see 30 and 60-day episodes of care, okay? With the mobile outpatient side, billing under that Medicare Part B, we're looking at 90-day episodes of care. So coming out for 12 weeks, gonna work with you, and as the episode of care progresses, we're addressing things, we're addressing needs that are really going to help maximize like a senior's ability to remain in their home and as independent as possible, right? Um, some of the real benefits of this mobile outpatient, the convenience of mobile outpatient, it allows patients to receive care in the comfort of their home, right? So it's really hard to mock up a client's personal living environment if you're working with them in a skilled nursing facility, or if you're working with them in an assisted living, well, I'm sorry, in a hospital setting. If you're working with somebody that's on a short stay at an assisted living facility with the plan to tentatively return home, working with the client in their home is, I really like to say that's where the rubber meets the road when it comes to keeping these senior citizens out of skilled nursing, keeping them in their homes, and keeping them where they want to be. One of the other benefits of mobile outpatient is the privacy. Again, we're working with them in their home. You're not having to bring them out into the clinic where there's tons of other people around and they're probably already kind of intimidated, anxious, nervous. Now they're in a busy environment, and uh, working with them in the privacy of their home, I find that my clients, patients, they're just more relaxed. They're just you know less tense, less on edge from being out in that public environment. Something about just being at home is a little soothing, right? The flexibility of your frequency and episodes of care that you can draw on a client. Appointments can really be set up around that client's schedule. Uh, Again, they're being seen in their home, but they don't have to be homebound. So a lot of times I'll see clients out in public if they're recovering from a hip replacement, or if they're recovering from a heart attack or effects of a stroke, and maybe they liked to go out and do shopping with friends, or go out and they had a walking group that they really want to get back to doing, but they want to feel safe and they want to feel confident. Well, we're not limited to just them being homebound, so we can meet out in public. We can meet where they want to be to get them back to that level of function and that level of activity that makes them happy. Um, with the mobile outpatient, again, you're getting that really personalized care. You're getting that with your traditional home health. With the mobile outpatient, you're just getting that skilled clinician. You're getting those skilled eyes to come in. They're seeing you in your home. They're seeing what's really going on. Um, it just really opens up your plan of care and what you're wanting to work on. It really opens up, hopefully what you're going to be doing, because again, you don't have to you don't have to pretend or try to visualize or mock up, okay, what does this person look like in their home? You see them in their home every day, and you see a lot of the things that maybe family doesn't see. You see a lot of the things that maybe friends don't see. You see a lot of the things that maybe doctor doesn't know about, right? Um, that can help lead to, a reduced risk of falls, a reduced risk of infection, right? Um, it can help to it can help, when the client really understands that the skilled care they're receiving from mobile outpatient is really benefiting and helping improve their chances to stay in their home and stay out of that living facility that they don't want to go to. They tend to adhere a little bit better to their episode of care, or to their homework, right? They tend to do their home exercise program. They tend to maybe get that little piece of equipment that, yeah, I'm not a fan of using this, but it really does help me when I'm trying to get out of bed. Just having this bed cane here, I feel more safe, I feel more stable, and I haven't had a fall since the PT put it on the bed. Um, that leads to that increased independence. Um, if you decrease the level of falls that are happening in the home, you decrease that fear of falling. You decrease that chance that the client's going to end up in the hospital and over to skilled nursing and hopefully return home. Um, and then another accident happens and it's back to the hospital, skilled nursing, return home. Mobile outpatient therapists can really help break that cycle and keep that patient from doing, that doom loop, so to speak, that rehab hospital course doom loop. With the mobile outpatient, you tend to have the same therapist for each appointment, so you really get to know the therapist. Again, being seen in the comfort of the home or out in public, wherever you like to be. It's nice having the same person coming out to work with you, so that you're not having to bring the new therapist up to speed every time the new one walks in the door, right? So it's nice having that continuity of care from the same therapist. Um, Usually, I'll see clients for my episodes of care, and I like to tell either them or their families that, with a typical, say, hour treatment 2 times a week, and I'm coming out for 12 weeks, right? So in that first month, I'm coming out for 2 hours, 8 hours total for the month. Okay, working with them in their home or out in the community. But so in those 8 hours, I've already spent more time with them than their primary care physician, their uh, their orthopedic doctor, their neurologist, their cardiologist, their pulmonologist, their endocrinologist, their you know whoever the ologist or the physician may be. I've spent more time with this person in their home, and seen, you know, what's really going on, right? And getting that insight of seeing the client in the comfort of their home and seeing where say some of these fall risks and safety issues may be. It's much easier to address those and to kind of help, keep the patient a little, accountable for um just reminding them that their primary care doctors or whoever their all the members of their medical care team, they can only treat what they know, right? So if a client is open and honest, right, and accepting of that feedback, because the ultimate goal is to keep them in their home, uh, I've found that people are much more apt to, take some of these necessary steps to take control of their health, to take control of maximizing their independence in their home, to avoid pulling themselves out of their home and being placed in a facility where they don't want to be. So all of my visits kind of entail three questions right out of the gate. A lot of my clients will answer these questions before I even ask them, right? So question one is, have you had any falls since the last time I saw you? Question two, have you visited urgent care or the emergency department since the last time I saw you? Question three, have you had any changes in your medications since the last time I saw you? And I will never, not be surprised by, hearing that, oh yeah, I had a little fall, or yeah, the doctor changed such and such medication, or I did have to go to urgent care because I just couldn't sleep. I was, for whatever reason, and that's where you start to catch some of your little red flags with our seniors, things that start to kind of crop up that may otherwise just be brushed aside, like, it's no big deal. And those things tend to cascade and turn into bigger deals. And now we've got situations where, you know, we need a higher level of care. So from that mobile outpatient standpoint, working with seniors in their homes, my goal is to keep them in their homes, keep them educated about these things that can take them out of their home and ways to prevent them. Some of those signs and symptoms to look for, but we'll save all of that stuff for another video. Um, I would like to say that with the differences of your mobile outpatient and your traditional home health, they're both very, very beneficial and vital services. And I'm really hoping that mobile outpatient is going to get a little bit more of a foothold and a little more awareness for folks, that it's not so often confused with that traditional home health side, that so many people are they have that in mind when they hear mobile outpatient. They may mistake it for home health. So I really do think that mobile outpatient can be a vital piece of a senior's rehabilitation or just therapy services that they receive, and it really can help to keep them out of the hospital, out of skilled nursing, and pulling themselves out of their homes. So, a lot of times with my outpatient clients that I see in their homes, I do end up making recommendations, whether that's bringing in additional services, looking at some of the resources that are available through their local county, bringing in equipment, right? Whether it's durable medical equipment, assistive devices, making referrals for specialized equipment, because all in all, you know, with these individualized approaches to each person, you have to approach the person where they're at, age and stage, and what their plans are. And 9 times out of 10, people want to stay in their homes. So anyway, I just want to I think we'll just end it there for the first video that I'm uploading to this channel. I really hope that you found it insightful, educational. If you have any questions, please feel free to drop them down in the comments section. If you have any kind of topics that maybe you would like to see covered regarding mobile outpatient therapy, especially when it comes to that senior care side of things, feel free to post them below. I would love to take a look and see what maybe I could help shed some light on. And I really want to thank you so much for tuning in. Again, feel free, drop a comment below. Let me know what helped you, what didn't help you. I welcome the feedback. Welcome your suggestions for any topics that are interesting to you regarding skilled home therapy. And just always remember your age and stage is your own age and stage. Take care. I'll see you next time.